Welcome to a new video. In this video, we'll discuss about the pleural fluid. So before discussing about the pleural fluid, we'll discuss about the basic details of pleura. So what is pleura? Pleura is nothing but the covering of the lungs. The lungs are covered by an outer layer which is called as pleura. And in between the layers, there are two layers of the pleura, parietal pleura and visceral pleura. And in between the parietal pleura and visceral pleura, there is a space which is called as pleural space. And in this pleural space, there is a pleural fluid. So depending upon the amount of the pleural fluid, we could be able to detect it via different investigations. So normally the amount of fluid which is present in the pleural cavity is around 10 to 30 ml. So normal fluid which is present in pleural cavity is 10 to 30 ml. When it is about 50 ml, then we can diagnose it by ultrasound. When it is about 60 to 80 ml, then we can diagnose by chest X-ray. And chest X-ray, which view? There is a lateral view. So 60 to 80 ml can be diagnosed with chest X-ray lateral view. And when it is about 200 ml, when the quantity has been increased to 200 ml, then we could diagnose it by chest X-ray PA view, that is posterior anterior view. PA view means posterior anterior view. And when the fluid in the pleural cavity is about 300 ml, then we could diagnose it by clinically. So this is how we will detect the pleural fluid depending upon the quantity which is present in the pleural cavity. So what is pleural effusion? In this video we will also discuss about pleural effusion. What is pleural effusion? Pleural effusion is nothing but collection of fluid in the pleural cavity. This is called as pleural effusion. And depending upon whether it's a transudate or exudate, we have Light's criteria to distinguish between the transudate from that of the exudate. Transudate means watery fluid, and exudate means some kind of cells or pus which is present in this fluid, which is making them as exudate. So the Light's criteria says that the fluid can be considered as an exudative pleural effusion if any one of the following are found. What are these criteria? The criteria for the pleural effusion to be considered as an exudate is the ratio of pleural fluid to serum protein. The pleural fluid protein to serum protein, when it is above more than or equal to 0.5, or the ratio of pleural fluid to serum LDH is more than or equal to 0.6, or when the pleural fluid LDH is more than or equal to 2/3 of the upper limit of the normal serum LDH. So there are there are three features or 3 points. If any one of these thing is present, then the pleural fluid is considered to be an exudative pleural effusion. So what are those three? Again we will discuss. The ratio of pleural fluid to serum protein, if the pleural fluid protein to serum protein is more than or equal to 0.5, or if the pleural fluid LDH to serum LDH is more than or equal to 0.6, or pleural fluid LDH is more than or equal to 2/3 of the upper limit of the normal serum LDH, then if any one of these the following is present, then we will consider it as an exudative pleural effusion. When nothing is present, then it will be called as a transudative pleural effusion. So coming to the causes, what are the causes which leads to the transudative kind of pleural effusion or exudative type of pleural effusion? So first cause is congestive cardiac failure or congestive heart failure is one of the important cause for transudative pleural effusion. And the other important cause is cirrhosis. Whenever there is a cirrhosis, it also causes transudative pleural effusion. And the third one is nephrotic syndrome. Nephrotic syndrome also causes the transudative type of pleural effusion. And the fourth one is superior vena cava obstruction. The superior vena cava obstruction can also cause transudative type of pleural effusion. And the fifth one is hypothyroidism. When the thyroid levels are less than that of the normal cutoff, then it's called hypothyroidism. So hypothyroidism can also cause transudative type of pleural effusion. And whenever there is a decrease in the albumin protein, hyperalbuminemia can also causes the transudative type of pleural effusion. And what is Budd-Chiari syndrome? Budd-Chiari syndrome is nothing but the obstruction in the hepatic veins. This also causes the transudative type of pleural effusion. So what are the causes? Let me revise. Let me say it again. So the causes of the transudative type of pleural effusion is congestive heart failure, cirrhosis, nephrotic syndrome, superior vena cava obstruction, hypothyroidism, hyperalbuminemia, and Budd-Chiari syndrome. And we also discuss about the causes of exudative type of pleural effusion. So exudate means when the pleural fluid protein to serum protein is more than or equal to 0.5, or when the pleural fluid LDH is more to serum LDH ratio is more than or equal to 0.6, and pleural fluid protein LDH is more than or equal to 2/3 of the upper limit of the normal, then it is called as exudate. So in this exudative pleural effusion, the causes for exudative pleural effusion is, first one is pneumonia, and other causes could be the tuberculosis, and the other causes are any drugs can also cause exudative type of pleural effusion, and the malignancies. And what is CTD? CTD is nothing but connective tissue disorders. The connective tissue disorders like rheumatoid arthritis, sarcoidosis can also causes exudative type of pleural effusion, and pancreatitis, inflammation of the pancreas, and any esophageal rupture can also cause exudative type of pleural effusion. So let me say it, the causes of exudative pleural effusion again. So the most important cause is pneumonia and tuberculosis, any usage of drugs, and malignancies, any connective tissue disorders like rheumatoid arthritis, sarcoidosis, pancreatitis, esophageal rupture. These are all the causes for exudative type of pleural effusion. And we'll also have some pleural fluid abnormalities and their associated diseases. So in this we have empyema. Empyema is nothing but pus in the pleural cavity. Pus in the pleural cavity is called as empyema. And what are the abnormalities in the pleural fluid analysis we will see in empyema is when the LDH in the empyema will be around more than 1000 units per liter in the pleural fluid. And we will also come to see the neutrophils in the pleural fluid analysis. In the pleural fluid analysis, whenever the LDH is more than 1000 units per liter and neutrophils are seen in the pleural fluid and the pH is less than 7.2 and glucose is around 30 to 60 gram per deciliter, the most important cause could be an empyema. And in malignancies, the glucose levels will be around 30 to 60 milligram per deciliter. In malignancies, the glucose levels will be around 30 to 60 milligram per deciliter. In the next video, we'll discuss what is about empyema. If found useful, just like the video and share with your friends. Thank you.